So, Boo, thanks for taking your time out to have a chat about green endoscopy. So, I think you have to explain the concept and why going green is relevant to endoscopy.
So it's an interesting journey. I kind of got into this just before COVID hit. We were talking about the environmental impact of healthcare in general. The NHS Net Zero plans were unveiled in October, and that kind of crystallized everything for us to say that, listen, our organization, our parent organization, recognizes the carbon footprint or the environmental impact of healthcare in general, and we should be doing our bit to contribute to the drive to achieving sort of as net zero as possible. And the more we looked into it as a group, the more we realized that actually there is a significant impact. Endoscopy is the third highest generator of waste in healthcare. We generate in terms of carbon footprint, but also in terms of just the waste, the stuff that goes in the bin, we generate around 3 kilograms of waste per bed per day. So it's a significant.
Gosh, I had no idea.
Yeah.
What is more resource intensive than even endoscopy?
Theatres and anaesthetics. Anesthetics is one of the bigger offenders, if you like, because of the gases they use, and Entonox is one of those gases actually that is incredibly. It's got a horrific environmental footprint. So we're keen on exploring ways to either not use it or to optimize its use. There are new technologies which allow you to recapture the gas that's escaping and crack it and catalyze it to some harmless forms. But in general, anesthetics is a high contributor, and perhaps single-use items are one of the drivers. If you compare our practice, and it has been compared for, say, ophthalmic surgery between the UK and India, the footprint of ophthalmic surgery in India is several times smaller, probably 6 or 7 times smaller than that in the UK. So the argument that sometimes gets posited is that developing countries are worse offenders. Actually, the reverse is true in healthcare, for sure. And so single use is one of those items. Yeah, so that's where it all started for me, is I kind of got involved through, obviously, my interest in endoscopy. There was another colleague of ours in Cornwall called Will Stapleforth, who's been a long-term environmental campaigner, much more sort of grey hairs in this. So he and I really worked together, and we created a group of like-minded, interested clinicians. We called ourselves Green Endoscopy. Obviously, that seemed like a good term. But we've been supported by the Centre for Sustainable Healthcare in Oxford. We've been supported by the BSG now. Keen to sort of bring everyone along and try and do our bit to make endoscopy as sustainable as we can.
So what can we do then in endoscopy to make it more sustainable, would you say? Are there any quick and easy fixes?
Yeah, that's a great question, actually. If we look at, if you kind of use the principles that hopefully everyone's familiar with when you talk about personal change in environmental sustainability, reduce, reuse, recycle. So we can reduce what we're doing. I think in endoscopic terms, that means triage. I don't think there's an endoscopy unit in the land that will say, yes, every single endoscopy we do is 100% appropriate. That's certainly somewhere that we can have an immediate impact. We learned through COVID that, unfortunately, that requires quite heavy administrative burden. You need to shove your senior decision makers closer to that triage line in order to make it as effective as possible. But it is worth it for all sorts of reasons. Environmental impact is one of them. Our catchphrase now is that the greatest waste is a procedure that didn't need to be done in the first place. And there's a recognition, though, that the demand for endoscopy increases year on year. We have to do triage, and that's probably the most impactful immediate step.
I remember maybe 25 years ago, there was a Swiss initiative to try to hone down on what procedures were the most likely to yield an outcome which would actually affect management. And it was difficult to spot things that we definitely shouldn't do.
As you say, the guidelines that exist right now to guide us in terms of appropriateness from BSG, from ESGE, and others are quite broad, but they will help us. And I think, broadly speaking, you and I think both review abstracts for the BSG. Whenever there's a conference, we have some people saying we validated our waiting list against the polyp guidelines, and usually it's somewhere between 15 and 40%. Sometimes inappropriate. So there's a big chunk of work there that could be removed, and you won't incur that carbon footprint. And don't forget, it's not just the procedure; it's the patient traveling backwards and forwards. The NHS is actually responsible for 5% of the whole of the UK's emissions. So it's a big chunk, and of that, 60% of it is because of patients traveling backwards and forwards.
The most wasteful endoscopy is the unnecessary endoscopy, or perhaps Roland Mallory would argue the endoscopy which is done badly contributes nothing.
Yeah, agreed. And actually, it triggered a memory in terms of biopsies as well. So the carbon footprint of biopsies is an interesting one, which we've just come across. There's been some work in the US. We estimate that for every 3 biopsy pots that you process, that's equivalent to driving 2 miles in a car. People take duodenal biopsies just to make sure, or gastric biopsies for no real reason. I remember a paper that was, I think it was Mark McLinden. They looked, or how often did the biopsies change practice in upper GI endoscopy, and it was something shocking, like 16% of the time, or some very, very low figure, that the biopsies actually really made a difference.
So that's a big thing we can do. And the first one on your list of 3, reduction. Yes. What was the second step?
Reuse. So that's an interesting one, because obviously over the last decade or more, there's been this huge drive to single-use everything. And now I think we're seeing the pushback against that, because I think we recognize that we can't just keep on doing that forever and ever more. And we used to reuse things all the time. Now there's a real drive in the NHS from the top down, including procurement and infection control and estates and everything, to help us to try and find ways to reuse things. Specifically, I think we can all come up with some ideas or some instances where we think we might be able to do that, but it's going to take some time to work through to kind of undo the last 10 years of single-use brainwashing, I guess.
And I guess also industry can play a part in this, come up with clever solutions and make changes in the design of equipment, maybe detachable head of the snare, so that can go in the bin and everything else is recycled. There must be clever engineering and design that can help us with reuse of equipment. Yeah,
and I think we will need to have fairly robust conversations with industry, because again, that involves investment on their part and costs on their part. But now more than ever, I think we're in a position as the NHS to say, if you don't do this, we won't do business with you, because we can't afford this anymore. And the NHS as a whole wants to ensure that it and its suppliers are sort of contributing to this net zero drive.
I can start vetting referrals tomorrow. And
I was going to say, the good news is we've got time for that. The net zero timeline is 2040. So we still have some time, but I think everyone's feeling the urgency now. We're seeing the effects of climate change around us, and we all feel like we need to be doing something to sort of minimize. One of the interesting things that the realization was that actually the impact of what we do in our personal lives is fine, and I would never dissuade anyone from making those changes in their personal life, but actually a lot of that will be completely wiped out by the wrong choices at work, or more impactful choices at work, and because of the volume and the nature of the stuff that we do in healthcare, it can completely, a day's work can completely negate your year's worth of efforts of carbon reduction in the household.
I cycle to work. That's
Yeah.
7 miles or something. That's 2 polyps analyzed, didn't you say?
And I wouldn't want to hold myself up as a shining example of environmental, activism or anything. But I don't want to say I'll never take a flight again. But I certainly haven't yet. And certainly to fly for conferences, I think is a difficult decision. I think now.
I think you're right. There might be engineering solutions out there to attend it virtually in 3D and kind of feel like you're there.
Yeah, I think there's certainly stuff coming, and I think maybe we have to find a way of minimizing international travel and just keeping national. Maybe we can have a national center which broadcasts so that at least people are being able to meet nationally than internationally.
Or choose places with very good rail links, for example.
Yes. I know Leeds is very well linked.
So that was reduce, reuse, but there's a third thing we can do, didn't you mention?
Yeah, recycle. And I think this is a really interesting one because there's a lot of technology that's already available, or a lot of infrastructure that's already available within the NHS to help us do that. The WHO estimate, and this might be an overestimate, but it estimates that somewhere between half and 80% of all of our waste in healthcare is recyclable, which is an interesting wake-up call because pre-2020, I think everything just went in the orange bin, and then that goes to be incinerated. But pre our sort of awakening, if you like, certainly in my endoscopy unit, that's all we had.
And still go straight up the chimney.
That's significant. The impact of that is several times greater than if you incinerate at high temperature, which is what you need to do for infectious waste. But if you can recycle, then you pretty much negate all of the carbon impact that way. Every hospital in the UK already has the infrastructure to recycle. That's pre-existing. All that a unit would have to do is to ask their waste management team or their estates team to put the recycling bins or to give you the recycling bins so you can put them in your endoscopy departments or the endoscopy rooms. And so when you unwrap a snare or when you unwrap a piece of equipment, that wrapping is recyclable. So you can put that, and it hasn't been near a patient, hasn't touched a patient, hasn't been used in direct patient contact. So it can go in the recycling, and at least you can begin to do that.
So you're not talking about the black waste disposal bin. This is a recycling bin.
Yeah. I mean, I guess you obviously have to caveat all of this by saying, listen, you have to discuss this with your local protocols. But I think mostly the protocols are the same across the NHS for that. So that's certainly one thing that we've been encouraging people to look into. And there are a lot of innovative companies who are now working with the NHS to recycle things that have been used in patient care. So previously things that we couldn't, by infection control policies, recycle, where people are making inroads into those things too. So hoping that will be something that we'll see more and more frequently.
And that's something we could start doing tomorrow.
That would be something that I would love everyone to do. If the reps and the industry hear the same message over and over again, then it's a bit like the plastic bags in the supermarkets. That change didn't happen overnight. It took a huge groundswell of, market research, popularity, peer pressure, all sorts to get that done. I think we need to do the same in our sphere. You then have to undertake a little bit of staff education to say what is the right thing to put into these bins. Don't put infectious stuff. Certainly don't put sharps in. And then it starts to get people interested and say, we're starting to recycle. That's great. What else can we do in our unit to reduce our environmental impacts? And one of the other things that we're doing, or we're asking people to consider, is appointing champions, a link nurse, a clinician. Get the endoscopy users group to have an agenda item for sustainability. JAG have actually made it part of their GRS. So that's really exciting and very forward thinking of JAG.
And you mentioned 2040. Is that the long-term goal then for the NHS, for health service delivery to be carbon neutral by 2040, would you say?
Yeah, that's the stated target. The net zero initiative is kind of set out in a document, and that's freely available online. It's a really useful read, actually. It's certainly the first document that I really read to start thinking about this. We're aiming for an interim of 80% by 2035, and it kind of sets some milestones. And so there's NHS itself and what we call NHS Plus, which is the supply chain and the partnership with industry. So yeah, lots to do, ambitious targets, but I think realistic and necessary. Actually, the other thing we should mention is water. Because of decon, we're possibly the number one, apart from maybe dialysis, but I think we're the number one users of water in healthcare. And the trouble is that's purified, ultra purified. It's taken a lot of energy to even make the water in the first place to the standard that we need it. The rule of thumb when we last looked at this with the reprocessors that we had, which one scope took anywhere between 70 and 100 liters of water per scope, per use. So you can imagine if you're doing, 6,000 colonoscopies a year, that's a hell of a lot of water, 600,000 liters of water per year just for one unit. And that's just for colonoscopy. The newer generation of scope cleaners, the automated processors are using less and less water. So we can even get down to maybe 20 to 25 liters of water for that metric. But even so, it's still a lot of water per scope, and it needs to be taken into account.
Yes. If you look at the three headings, reduce, reuse, and recycle, where would you say the biggest wins are in these three groups?
Yeah, well, I think reduce is certainly an immediate win. The NHS is, we're an anchor institution. We have a lot of influence. It's the biggest employer in the UK. So the chances are that somebody, you're walking down the street, there's a good chance that they work in the NHS already. So there's a lot of people who could be influenced and could influence others if we get our messaging right. And I'm glad to say that is happening, in the organization as a whole.
So, Boo, I admire you for tackling this big, difficult issue of green endoscopy.
I'm very humbled by your comments, but it's not just me. There's a group of us for sure, and that's partly the reason why we can make these changes, because I don't have all the ideas or all the answers as an individual. We need to be working together. You saw how the world mobilized when COVID hit. If we could put, even half that into climate change, then I think we'd be making some real differences. The threat from climate change is many, many times worse than COVID. COVID has been truly awful, but it's not really the thing that finishes us as a species.
So what's next, Boo?
Good, that's a great question. Getting more and more people to join in the cause and the drive to improve. I think the more people are involved, the more ideas we'll see coming through, and just encourage people to join Green Endoscopy. We'll be setting up web pages. There is a forum already that people can join through the Centre for Sustainable Healthcare, the CSH. The BSG is obviously putting up web pages so that people can contribute and send us ideas if they've come up with a new strategy, a new way of doing stuff. But yeah, for sure, everyone should be giving industry that message and saying, listen, we need you to do your bit now, and otherwise you'll find we won't buy your equipment anymore. There's guidance coming, BSG there's a group of us being endorsed by the BSG, and the ESGE, I know, are working up some plans, World Endoscopy Organisation too. So it's all happening. But yeah, it's definitely this is a ground up and top down sort of movement. We have to make it come from both sides and everyone do their bit.
Thanks for taking your time, Boo, to have a chat to me about green endoscopy. I'm going away a wiser man, I feel.
Great to talk to you.